Hello, my name is Steve Jones, and I'm running for the Kentucky House of Representatives District 23. This is another in my series of videos I'm making trying to share my views and thoughts of different issues with you. Today I'd like to discuss health care and also in a related way insurance. This has always been an important issue to me, but recently, actually very recently, it became a very important issue to me. You see, last Friday, in this very office at about 5:45 p.m., I had a stroke. I did. I know it doesn't look like it, but I did. I was getting ready to pack up my office for the day, and my right arm got kind of numb and tingly, and the left side of my mouth got numb and tingly, and I thought, well, that's kind of stroke symptoms, but not really. And I got up and I could move around. I went and looked in the mirror here in the office to see if the left side of my mouth was drooping, and it wasn't. But I knew it wasn't exactly right, so I called my wife, who's a physician, and she works in Columbia, and told her what was going on. And she wasn't sure what was happening. She said it probably wasn't right, and just to sit down and relax. And she was on her way. She'd get in her car and start heading this way and come see what's going on. So by the time that phone conversation was over, the symptoms had actually gone away. I was feeling fine. I mean, the numbness and tingling was gone, and it was all good. And I thought, well, okay, I'll just sit here and still going to sit here, just relax till my wife gets here to check me out. About 5 or 6 minutes later, the symptoms came back, and they came back hard. My left leg and left arm went completely numb. It felt like they had been full of water, and the water just slowly drained out over a period of about 10 seconds from both of them, or if they'd been full of air, the air just leaked out. I could barely move them or control them. I felt the whole left side of my mouth and face go numb. Before, when I looked in the mirror and my mouth wasn't drooping, I tried talking. I could talk fine, just like I'm talking to you now. When I tried talking after my leg went numb and my arm went numb and my face went numb the second time, I could barely talk. It was slurred speech. So I knew that was something pretty bad happening. So I picked up my phone with my right hand and speed dialed my wife by voice using Siri and told her what was happening. And she said, hang up and call 911. And I did. And she did as well while she was in the car on the way. So I got on the phone with the 911 operator, and she was very nice. She stayed with me on the phone the whole time. The EMTs arrived. They were able to. One of my big concerns was that here in where our office is at on the second floor of South Central Bank, you need a code to get in. And I was concerned that I wouldn't be able to tell the EMTs and through the operator what the code was to get in, because I was the only one, I think, in the building at the time. Everyone else had gone home before I lost my ability to speak clear enough at all for her to understand me. But luckily I was able to do that. And so the EMTs arrived, and they were wonderful. They took great care of me. They kept me calm, and I'll tell you, I was panicking. I was more scared than I've been in my life in a long time, if maybe ever. Put me in the ambulance, took me over to TJ, took me right out of the ambulance and put me into the CT scanner. I mean, CAT scanner or CT scan. I don't remember what. It was a blur. I was still having trouble. Never lost consciousness. When the ambulance picked me up and took me downstairs, just as they were rolling me into the ambulance, my wife arrived. And that can kind of tell you how fast she was driving down the parkway to get here, because I'd called her just before I called 911, and she was here from Columbia by the time I was being loaded into the ambulance. It was a scary, scary feeling seeing my wife standing there and seeing the look on her face, both as my wife and also as a doctor. It was not a good look from either aspect. I was able to grab her hand one time, and we were able to squeeze each other's hands, and she said, I love you, and I kind of gurgled it back at her. And then we took off in the ambulance, and it was pretty scary thinking as those doors closed that might have been the last time I ever got to see my wife. But we went to the hospital, got to the hospital, and they put me in the scanner, and they injected dye into me to make sure, I guess it helps stuff show up and make sure there was what was going on in my head. By the time I came out of the scanner, the dye made me sick, so I got sick, but they said that's not unusual. But by the time I came out of the scanner and got sick and started heading back to the emergency room, I was feeling a lot better. And gradually over the next couple of hours, I felt better. The symptoms all went away. And while I was in the emergency room, everyone treated me very well. I'm 57 years old, and I have never in my entire life had to go to the hospital for anything, let alone something like this. But they decided they wanted to keep me overnight for observation. They did a telemedicine conference with a neurologist. He was on a little monitor, and he had me do all these exercises and movements to see how my body was responding. And I had back full control of my body by then, but again, they just wanted to make sure I was okay, so they kept me overnight. Woke me up every couple hours or so to poke me and prod me and take my blood pressure and all that, which is fine. I understand that. With anyone that's been in the hospital, I even knew that was going to happen before I even ever went to the hospital. Because I've had people that have friends that have been in the hospital before, and they say getting a good night's sleep's the hardest thing. But you know what? I'd rather be woken up and checked on than just left to lay there and sleep all night. The next morning, Saturday morning, I had an MRI, and we were going to try to do I guess it's like a heart ultrasound, but they weren't able to do that on Saturdays. But the MRI came back okay. We also tested to see if I had the coronavirus. Part of the reason for that, it's mainly happening in people younger than me in their 30s, but there are people that are getting the coronavirus and having strokes. And people go, oh, we try to blame everything on the coronavirus. But the thing with me is, I never had any symptoms of anything like this before. There were no indicators in my life, my medical history, that I would ever have a stroke. I'm overweight. Yeah, I'll be the first to admit that. But I've never had any history of high cholesterol. I've never had a history of high blood pressure. I've never had a history of any heart disease in my family. Overall pretty healthy, other than being overweight. So part of the scary part of this was trying to say, well, what caused this? What caused me to have a stroke? And so that's why we looked at COVID too, just in case there was a connection. Had I been positive for COVID-19, that might have given us a hint. And like I said, that's the scariest thing about the whole thing, is now that I'm back and I'm fine and I've recovered from that stroke, not knowing exactly why it happened. I mean, hopefully maybe we're going to have to do the heart ultrasound as an outpatient sometime this week. So maybe we'll learn something there. But it is kind of scary just not knowing and thinking, well, could it happen again at any time? So anyway, I wanted to say, while I'm here talking to you, a huge thank you to the ambulance folks, the EMTs, to the nurses and doctors. I really appreciate it. I wouldn't be here without them. So I appreciate that. I've never had to use a hospital before, and I'm glad we have a hospital like TJ here. I'm glad I was able to get to the hospital in minutes, and literally minutes after being brought in the door, I was being treated inside of the scanner. So thank you to all those folks. On my personal Facebook page, I'm posting kind of a written narrative of some of this, and in there I've got the names of the nurses and doctors that I was able to catch. I want to thank them personally there. But if I try to name them here, I'm going to miss everybody, or I'm going to miss some people. So I just want to say thank you very much for all you did for me to keep me calm and to keep me alive. But the reason I share that personal story with you is to get on to the next step of what we all face when something like this happens, is the cost of healthcare. I don't know how much this is going to cost yet. I talked to my wife, who's dealt with this type of thing before with her patients, and she says we're probably looking at a medical bill of at least $100,000. Now, luckily, we've got medical insurance, but like a lot of you, it's incredibly expensive. Just for myself and my daughter, we're insured through my wife's employer, and her insurance is paid completely by her employer. But just to put myself and my 16-year-old daughter on that plan, it's $900 a month. And I know some of you pay more than that, some of you pay less than that. But that's a lot of money per month to be paying. And that's for what I call a catastrophic plan. In other words, it doesn't pay a dime, doesn't pay for anything until we have to pay $5,000 out of our own pocket. So we've never really used the insurance part of it. Anything we've had before, small little things, prescriptions, things like that, we just paid out of pocket. We're coming nowhere near that $5,000 deductible off the top. Luckily, we've got that policy, and between her and I, we have two health savings accounts, and between the two health savings accounts, we've got about $5,000 in those. So this hopefully won't cost us much of anything at all, because everything after the $5,000 deductible for a year, and that's just for one person. That's $5,000 for me and $5,000 for my daughter and $5,000 for my wife. So if two of us were hurt in a car accident, we'd have to pay $10,000 out of pocket before the insurance paid a dime. So that's why I call them, a lot of people call them catastrophic policies, because they're really only good for something like this: a stroke, a heart attack, a major car accident. They aren't going to pay for anything else. And so we're good. We'll make it through it. My wife's a physician. I'll be honest, she makes a good salary. We'll make it through this, and I can get a lot of care from her directly that she won't be billing me for. So I can get checked up pretty regularly without having to worry about being paid for an office visit. But a lot of people don't have that. A lot of people don't have health insurance at all. If I hadn't had health insurance, or if I hadn't been on that policy, this would have been devastating. This would have been $100,000 I would have had to come up with, our family would have had to come up with. And there are a lot of people out there who don't have health insurance, who just don't, because they can't afford it. I'll be the first person to admit I am not a huge loving fan of the Affordable Care Act. It's got problems, and I'll be the first to admit it. But the problem I have is that at least we have the Affordable Care Act. And instead of saying we need to trash the Affordable Care Act, get rid of the Affordable Care Act, why don't instead we say, look, there's some good things with the Affordable Care Act, pre-existing conditions, getting to keep your kids on your policies till they're older. There's some nice things about it. And some people actually are paying less under the Affordable Care Act. So it's not everyone's paying more, but some people are paying more. Why don't we look at the Affordable Care Act, find what's wrong with it, and fix it, instead of doing this partisan, well, you know what, this was Obama's policy and we hate Obama, so let's just scrap the whole thing. I'd even be in support of scrapping the whole thing if somebody had a policy written up to replace it. But the Republicans don't. They just want to tear it apart and leave millions of people without health insurance, millions of people that could be very easily in the exact same situation I was in, having an unexpected stroke when you had no background, no history for it, completely unexpected, you're not a high-risk person, and suddenly dealing with hundreds of thousands of dollars of medical debt. I just don't understand that. We need to work together to achieve affordable health care. I do believe health care is a right. It's a basic human right. No one should have to mortgage their home to survive a stroke. No one should have to be in debt for the rest of their life. We need to find a solution to this. Things are just way too expensive. I mean, $100,000 for one night in the hospital. And, you know, I'm sure the hospitals, and I'm not knocking any hospital, I'm not knocking TJ or the doctors or anyone. I'm sure they can justify these are why these costs are so high. But we have to keep in mind that not everyone, very few people can afford a spur of the moment $100,000. It's suddenly like walking up to a person and saying, hey, suddenly you got to buy a new house. Do it. You got to do it. Or we're going to take away your old house. It's just completely insane in some ways. So I think we need to work together, both Republicans and Democrats, to find a way to provide health care to everyone in this district, in the Commonwealth, and in the nation. I know a lot of people get scared and don't like the idea of socialism and things like that, but socialism is already here. We already use it all the time. It's in our Social Security system. It's in fire departments and police departments. And it's anytime you pay money, we all pay money into one pot to give services to everyone. That's socialism. So why don't we do that for health insurance? I know as the our family, we pay a good deal in income taxes. But you know what? My wife and I have talked about this many times. We'd pay a little bit more if it meant everyone could have health insurance. If everyone chipped in their fair share and weren't always looking for the loopholes and weren't always looking for a way to reduce their tax bill and try to cheat the system as much as possible, if we all paid our fair share, the rich, the poor, corporations, if we all paid our fair share, there would be money to do things like this. We also need to look at the medical industry and try to get some of that reined in. There's no reason why a drug that costs $3 to produce should be sold for $900 a dose. I know they often say they're trying to recover their research and development costs, but you know what? Some of those drugs have been around for years and years and years. You've got to have recovered your costs by then. It's a system that's broken, and there's no way to fix it unless we really want to fix it. And that's the problem. We've made it a political hot potato, knocking it back and forth between parties, blaming each other, and that's got to stop. That's got to stop. I mean, I'm really lucky and blessed that I was able to have health insurance that covered this, and that I'm going to be okay. My family's going to be okay. We're not going to have to tell our youngest daughter, sorry, no college for you. We had to spend it all on my medical bills. We need to work together to get this done. And if we can't do it at the national level, then fine, let's start it at the state level. I know it's a hard time to be talking about something like this with the pandemic and the budget and businesses suffering, to say we're going to now try to put together some kind of health care for the system for our state. But at least let's talk about it. Let's not just throw our hands up and go, oh, we can't talk about this now. It's just not possible right now. Let's start the discussion. Let's start talking about what we can do to save people who aren't as lucky as I was. There are going to be people who simply don't have that money to pay those bills and do those things. Another big issue that in this field that I often hear my wife talk about is someone will go through something like this, and as I mentioned, I have to do a follow-up, a heart echo or heart ultrasound or whatever they call it. A lot of people will then go, oh my gosh, I've already got a $100,000 bill. You know what? I'm okay. I feel all right. I'm not going to follow up with that because I can't afford that other test. It's going to be $4,000 more or whatever. And that happens a lot. A lot of people, she sees her patients, they don't do the follow-up because the treatment to begin with was so expensive. They don't do the follow-up. And then guess what happens? They either end up in a critical condition again and have to go in and pay even more huge amounts of money, or they die. She's had patients that have simply died because they couldn't afford to go in for the follow-up treatment, and that's heartbreaking. No Kentuckian should die simply because they're afraid of a bill they're going to have to pay if they go seek medical care. So let me wrap this up saying, please think about others. Think about other people who may not be in a situation as lucky as you or I, who may not have health care. Don't assume it's because they're lazy or no good or feeding on the system. Some people are busting their butts, doing the best they can, working 2 or 3 part-time jobs or a couple of full-time jobs, and still can't get insurance, still can't get it through their employer and can't get it because they can't afford it. We need to fix this. I need your help to fix this. It's going to take all of us to fix this, and I really want to fix this, very much so. I don't want anyone to have to go through what I went through and then on top of it come out the other side and go, well, I feel better, but now I'm financially destroyed. Thank you all very much. You have a great rest of the day.